We're concerned about what's going on in Montreal, in Montérégie, Laval, and even the region of Quebec, where the profile of vaccination is lower.
About 10 cases of the measles have been identified in Quebec, 7 of those in Montreal, where vaccination rates are lower. Public Health on Monday urging caution in vaccination, which is free. Measles cases seem to be spreading through community contacts, with only 3 having come specifically from traveling.
We hadn't seen measles transmission since 2019 in the province of Quebec. So the minute you see local transmission, there is already concern there. It means that we haven't been able to contain it with our 95% population protection. And so we're really aiming to stop it at 10. If we stop at 10, we'll be very happy.
Measles is highly contagious. The virus can remain active and contagious for up to 2 hours in a room even after an infected person has left, and it has a long incubation period, usually between 10 and 14 days. Symptoms include fever, cough, and a bumpy red rash. In rare cases, measles can be fatal, and dangerous complications can occur in young infants as well as unvaccinated pregnant women and people with low immunity.
We're worried about the fact that there's a lot of Quebecers that are presently out of the country and that they might visit countries where the measles will circulate more than here, which is the case in most of the countries in Europe, and even on the United States there are some outbreaks out down there in Florida, so we're worried about the next week's situation.
In some schools in Montreal, the vaccination coverage was as low as 40 to 50%, while in others it's more in a 70 to 80% average. So the overall goal is to increase that vaccination coverage so that if ever there is an imported case, there is not going to be any further transmission.
We're planning with the health authorities, the local health authorities, to go in school for special operations, but specifically schools with low coverage will have specific intervention after March break. And the other thing is going to be done in the province of Quebec, but mainly in Montreal also. We're going to call people that are not adequately vaccinated.
Children today who haven't gotten their 2 doses are most at risk, and that's what is largely fueling this global rise of measles. It's that vaccination rates have been slipping. Ideally, we would want vaccination rates to be at a 95% threshold to ensure herd immunity, to make sure that there is no community spread of measles, and we've seen that slipping.
Montreal Public Health and other regional health authorities have a list of possible exposure sites on their website if you feel you may have symptoms connected to measles.
2 doses after the age of 12 months, you're usually absolutely well protected against a resurgence of the disease. And if you do develop the disease, because sometimes it happens, we do have breakthrough like in everything else, then the risk of complication is 0 or almost 0.
In Montreal, Anastasia Dextrene, City News.